Okay. I think a few more are doing squats, and you got it right. So actually only 63% of the member organisations in the countries around the world prepare physical therapists for autonomous practice through education. And I think that's really important for Pip, who's going to be talking next about prescribing. Pip, I'm just going to say you're a CSP professional advisor, that's the Chartered Society of Physiotherapy in the UK, and also have a health care law degree. So over to you, Pip.
Thank you, Tracy. Well, first of all, thank you very much for inviting me to speak. I feel very privileged to be here. And as another speaker said to me earlier on in the week, you know you've achieved something when IFOMPT asks you to speak. So no pressure then. So I'd like to share with you the UK experience of how independent prescribing has changed our profession, in the hope that it may well be useful to some of you here to take back to your own countries and to your own practice environments. Please feel free to tweet or photograph as we go through the presentation. That would be very good. So what is independent prescribing? I couldn't find a definition that really encapsulated the full essence of what independent prescribing is. So in that best of current traditions, I made it up. Although in this case, this definition and this claim really is truthful, factual, and can be repeatable. So for all the legal geeks or any other fellow legal geeks out there, in the United Kingdom, all prescribing rights and all medicines and prescribing law is defined by the Human Medicines Regulations 2012, which largely repealed the Medicines Act of 1968. Not that I'd thoroughly recommend it as a good read for you, but if any of you do ever suffer from insomnia, I'd thoroughly recommend it as a great cure for sleeping disorders. So currently in the UK, independent prescribing is available to 8 professional groups, doctors and dentists, as it always has been. But it's also available to some nurses, some pharmacists, optometrists, physiotherapists, podiatrists, and just recently, therapeutic radiographers. The rights were granted to physiotherapists along with podiatrists in 2013 after a long campaign really making the point that current, at the time, medicines law and medicines framework met neither the needs of modern healthcare practice and practitioners, nor did it meet the needs of patients. There were at the time other medicines frameworks available to physiotherapists, namely patient group directions, which is a supply mechanism, and supplementary prescribing. But those were the only 2 that were available, and unlike our podiatrist colleagues, physiotherapists legally didn't have the right to, and still don't have the right to use exemptions. So we managed to secure a change in the law, and in the UK, the scope of practice of UK prescribing is simply this. The physiotherapist independent prescriber may prescribe any licensed medicine, and that will include a licensed medicine being used for off-label use, within national and local guidelines, for any condition within the expertise and competence of the practitioner, within the overarching framework of human movement, performance and function. So it's very wide-ranging, and that was deliberately so to reflect the breadth of the scope of practice in the UK. It does also now include 7 controlled drugs, which are those particularly nasty medicines that we put an extra layer of legislation in, but it doesn't include unlicensed medicines, and there's no moves to ever allow it to be able to do so. There are currently approximately 500 registered physios in the UK who have a practicing certificate annotating them with our regulator, the Health and Care Professions Council, to use independent prescribing. And having a think about things, preparing for this presentation, I thought this could be a very useful dissertation for any prospective master's students out there, in that given that there are 43,000 registered physios in the UK, why aren't more prescribing, given the impact that we are hoping to show that it will have? So really, now we know what independent prescribing is, what is its role? And there is an awful lot of sensitivity out there around the scope of practice of physiotherapy, and by some, the creep that has come into our practice. And we heard Roger Kerry talk yesterday about where the boundaries of scope of practice lie, particularly as we move into the more advanced practice roles and we really demonstrate our autonomy in practice. So where does the boundary lie, and how do we avoid treading on the toes of other professions? So what I would say to you, and a key message about prescribing in physiotherapy, is this is not about what we take away from other professions. This is about what we add to our own practice and to our own role as physiotherapists, and it's what we can deliver to make a benefit for patients. We are very, very lucky in the UK to have full autonomy in our practice, to be able to be a first point of contact practitioner, to be able to assess and diagnose, request investigations, and to make those decisions. And it really is that autonomy that is fundamental to being able to expand your practice and then add extra things such as prescribing to that. So it has a role, but it's augmenting what we do. So this is about how we make physiotherapy practice better for patients. It's about making things better for patients, not only for the individual patient in front of you, but for populations of patients for whom a physiotherapeutic approach really can make an impact. It's about offering efficient, effective, economical, and evidence-based practice in what we do. And surely those words alone should be catnip for commissioners out there, if you can offer that in a practice. It's about being safer for patients, so with clearer lines of responsibility and accountability, and reducing the risks and costs of the patients going round and round in circles that Nadine talked about earlier. It's safe. It improves patient outcomes through maintaining independence, by preventing acute conditions becoming chronic, and enhancing management of long-term conditions. I realise the current audience, you're all musculoskeletal specialists, but the impact that prescribing could have on respiratory conditions or on long-term neurological conditions really is quite profound. And it's about expanding the horizons from the patient experience of care, giving clear, accessible services to clinicians, reducing travel time, reducing travel costs for patients who are already under enough stress and strain that they've got a concern for which they're seeking help. But that's at the patient level. So why has prescribing expanded horizons? It has an impact, or it could have an impact, on whole services and potentially whole health economies, which certainly for the UK at the current time is an absolute priority when we consider our NHS and the difficulties and challenges that they face. In the UK, physiotherapists make up the third biggest workforce. There are 43,000 physios in the UK. And whilst prescribing is an advanced practice activity, if you release the inner potential in a large part of your workforce, you can then make the best of what resources you have. It's not simply a case of needing more, it's releasing the potential you have with what you've got. When you've done that, you end up creating capacity in a system because you allow the service, i.e. prescribing, to be accessed at more points within the whole health economy. When you do that, you then allow your services to be redesigned around the patient and their needs, and not, which has sadly happened in the UK for many decades, being designed around the hospitals and the workers within them. By the time you've redesigned your services, you then enable physiotherapists to take the lead over the total care pathway management for those conditions that we know are amenable to a musculoskeletal approach. And this brings me to the last point, which I cannot emphasise enough. Prescribing, when you add it to our toolkit of physiotherapy practice, gives us our unique selling point over and above all other professions. We really are not quite the all singing, all dancing, though maybe some physios are, but we are able to assess, to diagnose, to investigate, to plan treatment, and to deliver the rehabilitation, all in the framework of adding prescribing. So bringing it down to a more specific service level, Nadine spoke earlier of how physiotherapy has a key role in managing musculoskeletal conditions. Prescribing can transform care in better community and primary care services, particularly if you are in areas where you have a high demand for orthopaedic services or high demand for secondary care referrals. So combined with the ability for assessment and diagnosis, prescribing really makes an impact and realistically gives an alternative for patients. It then ensures that GPs have more time with their patients, which is music to their ears, to see those patients who need a more complex medical care. And in the hospital services, it frees up the orthopaedic surgeons for their time, which ought to be dedicated towards giving specialist surgical opinion and complex medical advice, and not managing non-specific conditions. If you take it into A&E services, the impact here, this isn't just musculoskeletal conditions, it's acute neurological conditions, elderly care, falls management. And if you consider that physiotherapists in their role already undertake expert assessment and management, adding prescribing just adds to that. And physiotherapists managing musculoskeletal injuries have equivalent clinical outcomes and lower direct costs than doctors and emergency nurse practitioners, which again is often a key driver. And ever since 1977 in the UK, when we had autonomy, prescribing is really now transforming care in either private services, which have always been first point of contact, or NHS services where we now have first point of contact practitioners. It's now offering a real alternative to patients to access effective care for those musculoskeletal conditions. So, as with anything complex, which for me is computers, you need a helpful guide of how you get there. And unlike my daughter, when I say to her, "Oh, can you help me with my computer or my PowerPoint?" she looks at me and says, "Oh, Mum, get with the teenagers, will you?" But I'm trying to be a little bit more helpful for you. So even for those of you from countries where you don't perhaps yet have full autonomy, here's my guide to seeking independent prescribing made simple. Step 1. Understand the modern scope of physiotherapy practice in your country. In the UK, at least 35 years after we had autonomy, I was surprised the number of politicians or policymakers who said, "Oh, can you do a bit more than treat my sprained ankle?" That's one of those, moments. But if you really need to understand what you do now, and you need to be able to convey that to the people you're seeking to influence, identify what it is you offer and the breadth of what you can offer. Step 2. Review your existing medicines frameworks. What do you have in your country? What's the law? What are the problems with what you have already? Where do you need to make the case that what you've got is just simply not good enough for patients? Leading you on to step 3. Focus on the patient pathway. This is not about us as individual physios or individual career progression. This is about where can you make a difference for patients? Where can you get the greatest effect? Where can you really enhance the rehabilitative potential? Step 4. Establish your robust clinical governance. You must be able to show that you are safe, that you can deliver reasonable practice and responsible practice, and that you have a strong, regulated profession that has really clear boundaries on standards of proficiency and guidance of practice. And that is something that we were really put under the microscope in the UK. How are you going to be safe? How do you know what you're doing? And really the message was, how do we know you're all not just going to run off and prescribe Botox for everybody who wants their wrinkles treated? And so that was the framework we had to work with. And step 5, I think, is say learn from others' experience. We were very fortunate in the UK in that the nursing profession had secured independent prescribing many years before physiotherapy, and pharmacists and optometrists had gone before us. And their key influence was very kind enough to join our project group and share with us their experience. And as physiotherapists, we've done that with radiographers who've just come behind us. And I think sharing the international collaboration is certainly at the Chartered Society. We're very happy to share our learning and experience with a wider audience, because it's a hell of a lot of hard work and you really don't need to be reinventing the wheel. So for the CSP's experience, the night before I had to go before a government select committee, and this was it, make or break, I was talking to my girls who were quite young at the time in the bath, and I said, I'm really nervous. I've got, mummy's big day at work tomorrow. I've got to influence some really important people and try and change the law. That they followed my work for years. I said, right, how am I going to do it? And my eldest, who was 9 at the time, said, well, mummy, it's really quite simple. Stand up for your rights, tell them what you want, and tell them why you want it. And as I fed this back to the project lead, she said, well, if I have to put a 9-year-old in front of government ministers, I'll do anything. We didn't have to go quite that far. But I think the key points that I would say to you from our experience is keep it factual, not opinion-based. There's a lot of emotions and sensitivities around seeking change for profession and patients, particularly when you need to change the law, which is just in the UK a behemoth of something to change. Keep it factual. Link it to something like the law or something very clear. So it's factual, not necessarily opinion-based. You really do need to engage with the doctors, which was fundamental for us. We've had a lot of support from the medical profession of practicing doctors who see the value of what physiotherapy can ask. But to be equally honest with you, there was a lot of resistance and there were a large number of doctors who were against it. And our key aim was, if we couldn't get them to be supportive, was at least to move them from being against to neutral so that they wouldn't scupper our plans. And we managed that. But you do need to engage the doctors on this. And this is about, again, back to, this is not what you're taking away from doctors. This is what we're adding to physiotherapy. Oh, and by the way, it might make your life as a GP slightly easier, and wouldn't that be a nice thing? And engage with the politicians and policymakers, the people in your departments of health, the people who have the ears of the ministers. Because if you don't understand the political process, political with a small p, if you don't understand the process of how policy is made and how that links to legislative reform, you will not get anywhere, because you need to find what that natural rhythm and process is, engage with it and surf it like a wave and just keep going to it. And I think in the UK, again, take this point. The message to you is, take this as physiotherapy and prescribing. It's not the threat to healthcare services or to doctors. We are the opportunity. And I think what I would say to you in conclusion, whilst I put up my contact details if anybody would like to contact me, is if you have the vision, the energy, the tenacity, and let's face it, the patience to sit the process out in a logical process, I sincerely hope that your patients in your countries can benefit in the way that we hope that UK patients will be benefiting from independent prescribing. Thank you.